Profits, tribalism, elitism. What are the major drivers of our healthcare system today? I'm Chad Swanson, and I'm an emergency physician, and I'm on a journey to understand and transform our health system. I've had a few comments recently about alternative medicine and about racism in medicine that I'm going to spend the next few days answering. I'm posting a video every day answering questions that I have and that you may have, or related to comments that I get related to health systems transformation, because I'm convinced that we need to reinvent, reform, reimagine our entire health system. I would say that there are 5 major drivers of our healthcare system today, and I don't think that any of them should be major drivers. The first one is rescue treatment. So as an emergency doctor, I see patients in the ER every day having heart attacks or bad car accidents or pneumonia, or they're having a mental health crisis. We have invested a large amount of our resources, our time, our focus around the care of a specific individual at a given point in time and what we can do to rescue them from that ailment or illness or injury that they're dealing with at that point in time. I'm borrowing that term from Brent James, who I think is now at Stanford. Rescue treatment is a focus that has been around for as long as mankind has been. We are focused as human beings on the short-term, immediate, even sensationalist pain that we're going through, injury that we're going through, and as human beings, it's much more difficult for us to plan and think ahead for our overall health and well-being. The second major driver of our healthcare system today is profits. So from the time that physicians began organizing around medicine in the late 1800s, they were price fixing, and then in the early 1900s, there was a focus on profits, and today profits is a major driver in our pharmaceutical industry, in hospitals, private equity, and in medicine in general. The third major driver of our health system today is elitism. So whether it be racism, which was a major part of the origin of our health system in the late 1800s and early 1900s, and which we're still dealing with today, or whether it be sexism. Elitism also transfers to universities and academics, where the focus is often on short-term projects or publications that will bring an individual researcher their grant money or publications without adequate consideration of the long-term health of our country or our communities. Elitism also exists within subspecialties within medicine, and we have learned over time and inherited an outsized respect for certain brands, whether it be a journal like the New England Journal of Medicine or an institution like Harvard. We value those too often at the expense of innovation that can translate into long-term health and well-being. Tribalism is the 4th major driver in our health system today. So I don't understand very well the science, but just whether it be sports games and teams or political parties or within medicine professions or specialties, we gravitate towards our own, and we stick up for our own, and we make arguments for our own, even if the evidence is not there for, or even if our loyalty to our specific group or organization or specialty or tribe does not translate into ongoing strengthening of the health system. And that brings me to the 5th major driver of our health care system today, and that's the idea of path dependence, and that is we have inherited certain ways of doing things, whether it be the way we pay for healthcare, or whether it be a certain policy or education or training requirements. We've inherited ways of doing things that we keep just because we've always done them, not necessarily because they're better. So all of these major drivers, from a complex systems perspective, leads to the formation of a subsystem, the healthcare system, which is part of the health system itself. And these subsystems create boundaries and develop certain ways of doing things, norms and language, which lead to the behavior of those subsystems. I think that the major drivers of our health system should be health and well-being for all at the lowest possible cost for all. And so that encompasses effectiveness, equity, and efficiency. And so the more that we can question or diminish the power of the 5 current major drivers, and the more that we can elevate and focus on health and well-being for all at the lowest possible cost, that's the way that we'll be able to transform our health system. I would love your thoughts, any comments or questions or criticisms. I'm just going to take a moment now to share some of the videos or books or articles that I've stumbled across or experiences that I've had. So Marty McCary, I think is his name. He's I think a surgeon out of Johns Hopkins who's written a few books, and he's just getting on my radar more and more. He wrote a book recently that I haven't yet read called Blind Spots, but I am listening to a podcast where he's interviewed by Peter Attia. Dr. McCary's basic point is that there are a number, I think they said about 20% maybe, of medical practices that were adopted without strong evidence and then became recommended practices, and how there needs to be a reformation in the way that scientific studies are considered and adopted within medicine. I've had several discussions with family and friends about these topics, and I think that's important. I think the more we talk about it, whether it be with family, friends, strangers, every discussion matters. There has been an increased recognition that I've had of the need for trust. So I think COVID contributed to a significant level of distrust between the public at large and health and healthcare organizations, and that's a topic I'll be covering. And then finally, the need that we as a society and communities have for improved scientific literacy and communication. So understanding what science is and how strong different types of studies are and what that can mean for what practices we adopt. Thank you.